NEET 2025 pathology recall questions. There was a mixed type of response about the question paper. Like actually, for many of the students felt that it was a mixed bag of both easy questions, PYQs, and obviously, as usual, some tricky ones also. We hope that all of you would have done well. Let's wait for the great results with fingers crossed. Yes. As usual, we have a huge number of contribution from pathology and its integrated parts. So we have collected 29 questions from the pathology, and we are happy to say that we have discussed all 29 questions in our workbook, Q banks, and also leaderboards and GTs, class test. So guys, we'll have see this how this pathology is playing a major role in this NEET-PG once again with the discussion from our workbook also. So the first question is, the activation of the caspase enzyme is involved in which of the following forms of the cell death? So as we used to say in our class that the caspase plays a major role in the apoptosis. At the first instant, apoptosis is there, but the same point you have to remember is it is also seen in the plays a major role in pyroptosis. Yes. So necrosis of caspase will not play a role, and apoptosis and necroptosis also caspase will not play a role, as necroptosis is a caspase independent process. So when apoptosis and pyroptosis together given, we'll prefer this as the best response. So the proof for the same thing we have discussed at many places in our workbook, you can see here. Moving on to the next question, a 68-year-old male presented with a lot of bleeding manifestations, and the peripheral smear image was given of like a phagot cells. You can see this phagot cells with a lot of rods in the cytoplasm. So this is a classical phagot cells. So obviously it is this AML M3 acute promyelocytic leukemia with the classic translocation 1517, that is PML-RARA gene fusion is there. So this is the same thing actually they have asked in the last INI-CET also. So as we say, like this is a PYQ and a highly repeated topic. So you can expect your juniors can expect this in the subsequent exams also. So you can see this, we have discussed the same thing in our workbook. Moving on to the third question, a 30-year-old man presenting with a painless, gradually enlarging testicular mass. So some are saying that the gross appearance of the testicular mass was given with a homogeneous surface is, and the characteristic histological image, that is the tumor cells, are showing this with a clear cytoplasm. So you can see some, we used to say this also has this fried egg appearance, that is a glycogen and lipid storage. And what is the most striking here is you can see this lot of lymphocytes. So lymphocytes infiltrating the tumor mass and this characteristic cells, and also in the 30 years, that age group, you will always think of a seminoma test as the first diagnosis. Yes, that is the best option here. So this also we have discussed a huge number of times in our classes. Moving on to the fourth question. A 50-year-old woman presenting with a gradually progressive headache and occasional seizures for 4 months. MRI is showing a extraaxial mass, and the very characteristic clue that was given was the dural tail sign. That is the characteristic of this meningioma. So dural tail sign, and in a woman with a headache and also with like a compressive effect, as we used to discuss in our class. This meningioma has a compressive effect rather than an infiltrative effect. So this is a case of a meningioma. Moving on to the fifth question, the characteristic thing we used to discuss in our class, remembering the letter C. Yes, a 5-year-old a child presenting with a visual impairment, headache, and a histological examination revealing this wet keratin. Yes, please remember the C's, classical C's, which we discussed in our class. Yes, children, cystic lesion, calcification, cholesterol-rich fluid. You will be thinking of the tumor starting with the C, that is craniopharyngioma. Yes, the origin is at case pouch, and as you can see here, this is a typical wet keratin. Yes, and this is origin is rat case pouch, but the diagnosis is not the rat case cyst. So the diagnosis here is craniopharyngioma. The tumor you will remember with the letter C. Moving on to the sixth question, some are saying that a classic history of the CLL was given, and they were asking you the most appropriate or gold standard investigation for identifying this CD markers, that is antigens present on the cells. So we used to discuss, like, whenever you want to identify the antigens expressed on this leukemia cells, the gold standard investigation is your flow cytometry. Yes, so flow cytometry on the peripheral blood, that becomes a standard gold standard investigation for our CLL. So that is our sixth question, guys. Moving on to the seventh question, one more question on a lymphoma. That is a question they have given, that characteristic lymphoma with a lot of centrocytes and a centroblast. And the very important clue in the question the examiner has given is the BCL2 positivity and also this CD10 expression. So this makes you the diagnosis of follicular lymphoma. Yes, the same thing actually we discussed in our leaderboard classes also. So do you remember that? BCL2 with the CD10, you will be always thinking of your follicular lymphoma, and obviously the translocation here is the translocation 14 and 18. This is also one of the standard question we got in this NEET-PG 2025. You can see here the translocation 14, 18. Moving on to the eighth question. A patient who recently underwent a surgical resection of the ileum and presenting with anemia, and the MCV, it is more than 110. So the most likely cause of his anemia, that is a characteristic because ileal resection is done. There is no place for the vitamin B12 absorption. So the diagnosis here is going to be the vitamin B12 deficiency. If instead they would have given just a blank of megaloblastic anemia, you would have choose that. But even if they given B12 and folic acid, you have to choose B12 deficiency. This is also a repeated question, repeat topics they have asked us. You can see here we have discussed a wide variety of causes for this vitamin B12 and folic acid deficiency. Moving on to the ninth question, guys. A child presenting with a severe infection and a lymphopenia affecting both the B and T cells, and the characteristic keyword, the examiner. That's what I used to say. Though the examiner gives you a big clinical history, you have to search for the keywords. Here the keyword given is the adenosine deaminase deficiency. So that is a case of SCID, severe combined immunodeficiency. As you can see here from our workbook, this SCID, this is constituting adenosine deaminase deficiency, constituting this autosomal recessive form of the SCID, whereas this X-linked is cytokine gamma chain mutation. Yes, so SCID also we have discussed in our class. And moving on to the 10th question. A tall male presenting with a visual disturbances and ophthalmologic examination revealing this ectopia lentis, lens subluxation also could have been given. So the likely gene mutated here is. So this is a characteristic feature of our Marfan syndrome. Marfan syndrome. Remember, guys, in our class we discussed to remember the features of the Marfans with the mnemonic Marfan itself. We remember. Yes. So the gene actually mutated here is this fibrillin 1. Remember this. This is also located at the 15th chromosome. We used to remember 3 diseases in 15th chromosome, no? So Marfan, Tay-Sachs, and genomic imprinting disorders. Remember this. So the answer here is the fibrillin 1. Moving on to the 11th question. A patient presenting with a progressive hearing loss and imbalance, and a histological examination revealing this alternating hypercellular antennae A and hypocellular antennae B, and somewhere saying that Verocay bodies was given, so we'll add that also. So the likely diagnosis here is, yes, it is none other than our nerve sheath tumor, that is schwannoma. Schwannoma. Yes. So remember, guys, this picture we used to discuss in our class, that Verocay bodies and hypercellular antennae A and hypocellular antennae B. Yes, this is a characteristic of schwannoma. And remember, neurofibromatosis type 2, high acoustic schwannoma, that also we'll use to recollect when we discuss this schwannoma. Moving on to the 12th question. So this is a classic history was given. So the patient was presenting with the enlarging anterior neck mass, and the tumor cells are positive for TTF1 synaptophysin chromogranin. That is an additional point given. But the characteristic keyword that is they have given is the characteristic amyloid deposits in the stroma. So thyroid tumor with amyloid, what else you will think other than our medullary carcinoma of the thyroid. Yes. So out of all the carcinomas of the thyroid, medullary carcinoma thyroid will have this homogeneous eosinophilic material, that is that amyloid. And also thyroid transcription factor, TTF1. Actually, this even thyroid tumors also, it is positive. Thyroid tumors only, it is first positive, apart from the lung tumors. Yes, remember guys. So synaptophysin chromogranin tells you that neuroendocrine origin. Yes. So this answer here is medullary thyroid carcinoma. You can see here this amyloid, the characteristic amyloid in the medullary thyroid carcinoma. Moving on to the next question, they have given the image of a transitional epithelium and they have asked this question. Usually in the exams, if you see, they are asking like one histological image and they will be asking about the basic lining epithelium or the basic cells seen in the tissue. So this characteristic appearance, that is a transitional epithelium with a superficial, that umbrella cell. So this is usually seen in this urinary bladder and also in the ureter. Moving on to the 14th question, that is, which of the following conditions is most strongly associated with the presence of anti-scleroderma 70 antibodies, actually, which is seen in a diffuse forms. So if you can see in this other forms, that is the Raynaud phenomenon, calcinosis cutis, actually they are the part of this crust syndrome, which constitutes this limited scleroderma. So this diffuse thing, the main important feature is that lung involvement, that is a restrictive lung disease, which is characterized by this interstitial pulmonary fibrosis. So this is the most correct option here to this question. So GAVE will not fit here as the feature of this anti-scler antibodies in systemic sclerosis. So moving on to the next question. A 16-year-old boy presenting with a jaundice splenomegaly. Remember, guys, we used to stress this. Anemia, jaundice, splenomegaly, that a triad is characteristic of your hereditary spherocytosis. Hereditary spherocytosis, and this is an autosomal dominant disorder. So the father is also having a similar illness here. So that also further adds to this. So the case here is hereditary spherocytosis. Hereditary spherocytosis. Moving on to the 16th question. So the patient was epileptic grouped vesicular lesions on the extensor surface, and also the characteristic history of celiac disease, that is a gluten sensitivity was given. Like skin biopsy, DIF of immunofluorescence finding was given, and you can see this, you would have seen this IgA deposits in the dermal papillae. So with the gluten sensitivity, celiac disease, and the associated skin disorder, you will be thinking of your dermatitis herpetiformis, where you can see this subepidermal bulla. Subepidermal bulla. You can see this dermatitis herpetiformis we have discussed along with the celiac disease. And the 17th question, like our very familiar question, that is the pattern pedigree chart was given, where the affected mother transmits the disease to all her children. Affected mother transmits the disease to all her children, whereas the affected father transmits to none of his children. So this is the typical maternal inheritance, and that is a characteristic feature of your mitochondrial inheritance. Guys, do you remember the same pattern, same type of pedigree we have discussed in our workbook, and we have read also a group of mitochondrial disorders, League, Pearson, Merv, Melas. Guys, remember this Kearns-Sayre syndrome we have discussed. So you can see this, the option exactly, the Kearns-Sayre syndrome was given. That is the typical mitochondrial disorder. We also used to recollect that it affects this of mitochondria, involves this oxidative phosphorylation. So it mainly affects the musculoskeletal and neurological manifestations of the feature of this disease. So this is a typical mitochondrial disorder. Moving on to the 18th question. A 35-year-old female ovarian mass, multiloculated mass was given, and elevated CA125. Yes. So elevated CA125 is more characteristic of the surface epithelial ovarian tumors and the malignancy. So in a typical clinical scenario with this elevated CA125, will be clinically first thinking of this serous adenocarcinoma. Serous adenocarcinoma, epithelial ovarian tumors. Moving on to the 19th question. Patient presenting with the history of cough, chest pain, and the very characteristic word, that is a key word that was given with this granulomas, non-caseating, and with the stellate inclusions within the giant cells. Guys, do you remember when we discussed this sarcoidosis, we were discussing this stellate bodies, that is the asteroid bodies, which are nothing but this obsolete cell organelles, along with we discussed with this Schaumann bodies with the calcium oxalate crystals. Yes. So this is a characteristic of our sarcoidosis. Sarcoidosis. So the asteroid bodies are seen in our sarcoidosis. So with that history, we are making a diagnosis of sarcoidosis. Moving on to the 20th question. So the patient, adolescent patient presenting with the skin freckles, basal cell carcinoma, and they were asking about which DNA repair pathway is defect. This is also a PYQ and we have discussed it many times, guys. Do you remember our nuclear xeroderma pigmentosa, where you can see this nucleotide excision repair? We used to remember the letter X here. Yes, xeroderma pigmentosa and nucleotide excision repair defect. Excision repair defect. So the answer here is the nucleotide excision repair defect. Nucleotide excision repair defect. Moving on to the 21st question, in which they have given some, not sure about the clinical scenario given, but the theme of the question that was we could recollect from the students was that it was telling you about that hemosiderin laden macrophages. So hemosiderin laden macrophages will be seen in all of the following conditions, and the question asked was except. So in a pulmonary, sorry for the spelling mistake, that is a congestion. So pulmonary vein congestion or the constriction, or even can be right ventricular failure or acute volume overload. You can see this hemosiderin laden macrophages, but protein losing enteropathy. Protein losing enteropathy has nothing to do with this hemosiderin laden macrophages. So when there is a bleeding occurs, that macrophages loaded with this hemosiderin will be seen usually. And remember, guys, we used to discuss this. The Pearl's Persian blue stain is also positive here. This hemosiderin laden macrophages. Moving on to the 22nd question, a case of a Sjogren syndrome was given, and they were asking about the characteristic features of dryness of eyes and mouth, and they have given that clear lab findings that antibodies, anti-Rho and anti-La, that is SSA and SSB antibody was given. Remember, guys, Sjogren syndrome, lip biopsy. We used to classically remember this lip biopsy with this Sjogren syndrome. Why we used to do lip biopsy? Because it is easy to get the appearance of this minor salivary glands, and easily we can demonstrate that lymphocytes are infiltrating into the salivary glands. So that is easy to discuss with this lip biopsy. So the answer here is lymphocytic infiltration leading to destruction of the salivary and lacrimal glands. So once again, to reinforce that salivary glands, actually lip biopsy is very diagnostic of our Sjogren syndrome. And regarding this question, some people were saying that a clinical scenario was given, and some were saying that it's a one-liner. So the characteristic keyword is our anti-mitochondrial antibody, AMA. So it is a very characteristic feature of your primary biliary cirrhosis or primary biliary cholangitis, anti-mitochondrial antibodies. Guys, do you remember our table column differentiating between this primary biliary cirrhosis and primary sclerosing cholangitis? Anti-mitochondrial antibody or characteristic of this PBC, whereas this P anchor is usually seen in PSC. Yes? Okay. Moving on to this 24th question. The people are saying that there was an image given of this fibrolamellar carcinoma, focal nodular hyperplasia, where you can see this central stellate scar. Yes. So this is a typical case of a liver mass with a central stellate scar. You will be thinking among these things, usually you'll be thinking of focal nodular hyperplasia. So hepatocellular carcinoma will not have this stellate scar. The metastatic tumors are usually multiple, and adenoma also will not have this. So among the given options, FNH, that is a focal nodular hyperplasia, is a characteristic one which have this central stellate scar. Remember, guys, we used to discuss this is seen in middle-aged females and also people who are taking this anabolic steroids, contraceptives with a normal alpha fetoprotein and no malignant potential. Yes, so a case of focal nodular hyperplasia. And this is clinical scenario plus a pathology integrated question. So a postmenopausal bleeding in a female, in a 65-year-old female, and the hysterectomy specimen similar to kind of this was I could get it from the students. So a cut surface of the uterus revealing the endometrial cavity with a proliferative growth in the uterine cavity. You will be thinking of this endometrial carcinoma. Endometrial carcinoma. Moving on to the 26th question. So a case of Tay-Sachs disease was given with a biochemistry integration, and the child presenting with a developmental delay or the seizures, cherry red spot, and the characteristic hexasaminidase alpha deficiency, A deficiency. Guys, do you remember this is also associated with the chromosome number 15 we used to discuss. So now actually slowly they shifted from, usually they will ask lysosomal storage disorders. The examiners are so fond of this Gaucher's disease. This time actually they are shifting it to Tay-Sachs. So the accumulated substance here is this GM2 gangliosides. Yes, we have discussed this also. A patient has a reduced levels of factor 9, a vitamin K dependent clotting factor. So which of the following likely cause to show improvement in clotting function after parenteral vitamin K injection? So among the given options, if you can see this in the biliary obstruction. So in the biliary obstruction, so the fat soluble vitamins are not absorbed, the ADK, that is not absorbed. So if you give this parenteral vitamin K injection, so there will be likely to show improvement because this factor 9 is going to be, synthesis is going to be improved. So the answer here is that biliary obstruction. Moving on to the next question. A patient presenting with a fracture and presenting following which they're presenting with a shortness of breath, petechial rash and anemia, the likely diagnosis, a very standard question, that is the fat embolism. Moving on to the 29th question, repeated episodes of meningococcal infection. So this is a characteristic one which we used to discuss in our session, that late complement protein deficiency, that is a C5 to C8, that is the, and this thing is prone for, these patients are prone for the Neisseria, pneumococci and toxoplasmosis. So the answer here is that terminal complement component C5 to C9 deficiency, they are predisposed to this Neisseria infections. Yes, guys. So hope you have done your exams well. We're hoping for the best results from you. So we wish all of you to get your dream seats in a good institution. We are once again happy to say that actually insist that the class notes, that workbooks, how valuable and you keep on this paper is also evidence that how the previous year topics and integrated topics keep on repeating. So this insists like the importance of this high yield topics, guys. So guys, wish you all the best. Thank you.